Hello, thank you for joining us. I'm Dr. Saurabh Joshi from the Vein Center, and today I'm going to talk about what to expect once your VenaSeal treatment for varicose vein has been done. So let's assume you've had your VenaSeal procedure done today, right now, and you're waiting to be discharged. So what to expect? Great. Please have a seat and let's discuss about what to do and what are the do's and don'ts. So first up, when you see your legs, we've done the VenaSeal procedure. Now, from the point of access or where the VenaSeal device went inside from, you would notice these type of plastic dressings. So these are tegaderms or offside dressings which are waterproof. So this has a absorbent pad over it and a plastic adhesive. This should remain in place for 7 days. It is waterproof. You can have a bath over it, you can pet it, that's no problem. It needs to remain there for 7 days. We are going to call you for a 7-day follow-up, and at that time we'll be removing this ourselves. You don't need to do anything about it. And other than that, there are certain other precautions. So the procedure that we did is very likely to be done from the ankle right up to the hip, and the GSV, or the great saphenous vein, and the short saphenous vein which we treat. The great saphenous vein goes from the ankle right up to the hip. Now, in that course, goes across your knee, and we would advise you that for a month avoid flexing your knees completely. So when you flex your knees, the vein that goes across the knee gets stretched. Although you don't see anything from top, on the inside, the just operated vein gets stretched, and it can cause some inflammation and some discomfort over it. In addition to that, if you've had bunches of veins on your legs, and these are the varicosities, so in addition to VenaSeal, we would probably also have done a procedure called sclerotherapy. Now, when we do the sclerotherapy, we inject a medicine in the veins, which closes the veins, but it takes some time to do that, and it requires compression. So, if we've done this percutaneous sclerotherapy concurrently while doing your VenaSeal treatment, we would be advising some form of compression. The most common way to do that is to wear varicose vein compression stockings. Mostly, our patients are being advised to wear knee length compression stockings. So when you wear these stockings, how do you do that, and how long do you need to put them on? So you need to put them on in the morning when you're getting ready, and leave them on for about 8 to 10 hours and take it off in the evening. What you need to look out for is when you walk around, or when you're wearing stockings and you're walking and you're doing your daily activities, they tend to move down a bit, and they tend to fold at the ankles and at the knees, at the joints. So this fold causes a high compression or a high pressure area, which can cause swelling on the legs and the toes if left like that. I would advise my patients to check your stockings, say every 3-4 hours or so, just to make sure that you don't have this kind of a fold. So it simply is, if the fabric gets folded on itself, and then this would cause a high compression area at the joint. If it is so, just pull it from top and bottom and make it flat again. This sort of a high compression zone is one of the common causes for patients to get post-operative swelling on the below the ankles and the toes. So if you get such a swelling, you can elevate your legs and rest for some time, and it will get better. In addition to that, some patients do have these bunches of veins, like I talked about sclerotherapy. Now, when you're wearing stockings, if your stockings are ending over the bunches of veins, then the edge of the stockings can go inside, can have an extra compression on the bunch of veins, and this unequal compression, with part of the varicosity being compressed and part open, can cause some discomfort. So I usually advise my patients to put some kind of a cotton roll or some padding that prevents this discrepancy in compression, and that's what we do with compression. In addition to that, you've been given some medicines. Now, these are uh, the the medicines will probably be an antibiotic, a anti-inflammatory medicine, and the anti-acidity medicine. The dosages and the frequency of the medicines would differ from patient to patient. We would be explaining that to you individually when we are discharging you. You would see some bruising on the legs, which would start typically 3 or 4 days after the procedure. Don't get scared. These bruisings would start to reduce in 4 or 5 days, and they would disappear in about 2 weeks' time. You might feel tightness along the treated vein, which is because the vein is shrinking and reducing in size. There might be some tenderness over the bunches of veins and over these veins as well. If it is hurting, or if you feel that these bunches are tender to touch, they're hard to touch, don't get scared. Put an ice pack over it. Ice pack is generally in India we get it in a medical store, a cool pack where you put it in the freezer, make it ice cold, and you apply wherever it is hurting, and usually helps. This tightness and the bunches will slowly reduce and disappear. It is normal to see bruising, especially on the bunches of veins. It gets better with time. Usually it takes about 2 months for it to completely settle, but it is a gradual process. You will notice a difference week on week. There would be some patients who are given some blood thinners. We will explain that individually to you, and how to take, when to take. If you're already on some blood thinners, the medicines that we give you would be a little different. Again, those will be explaining to you case by case basis. So that was pretty much most about it. About the varicose veins without the ulcers. Now, if you have a wound on the leg, a varicose ulcer, then you have to be extra careful. You have to be cleanliness is very important. If you're doing the dressing yourself, then make sure that you wash your hands thoroughly, use a hand sanitizer. Ideally wear sterile gloves while doing the dressing. How to do the dressing, do you need some kind of debridement procedure or something? That varies individually from patient to patient. We would be explaining it to you during your discharge. And this the dressing, you how frequently you change it. No, mostly you have to change it every day, but some the frequency would be told to you when we are discharging you. If you leave a wound dressing on for a long time without changing, say for multiple days, then it can be a source of infection, and that would that would make things worse. Some swelling in the legs is expected, some redness around the wound is expected because of the procedure. You might see a increase in size of the wound immediate post procedure, because that is because of the inflammation that the procedure itself causes, and we expect it to keep getting better with time. Large ulcers might need additional plastic surgery once the wound starts healing. That will be explained to you if you need it. uh, Other than that, if you have diabetes, sugar control is very important for wound healing. So most of our diabetic patients, when we do a pre-procedure check, we find that the sugars might be a little high, and they control it for the procedure. But once the procedure is done, some patients lose that control, and the sugar again goes up. Your sugar is controlled not just for you to be fit enough for the procedure. It needs good control throughout for the wound to heal better. So please take care of yourself. Take good sugar control. Monitor your blood pressure. If you have wounds on your legs, and if you are a thin person, you might need to take additionally protein supplements. Try to consciously incorporate more proteins in your diet. And if you do not eat a lot of non-vegetarian food, then you might have some protein powder supplements that would be needed for you to supplement it. And that's basically it. And I think we would be most of our instructions, this would cover most of our post procedure instructions, but some of them might be tailored according to each patient. And thank you for listening. Thank you.